I'm Sandro Galea. I have the privilege of serving as Dean of the School of Public Health, and I was asked to tell you a story about why I'm in public health. So here goes. So I was initially trained as a doctor. I'm trained as a primary care acute physician. I did my medical training in Canada at the University of Toronto, and I did a residency training that prepares one to do rural remote training work. So I worked in northern Canada for a while, and I worked in Papua New Guinea, Philippines, and the longest stint I did in a fairly remote place was in Somalia. So I was working in Somalia in the region of Puntland, which is in the northwest of Somalia. And for those of you who saw the movie Captain Phillips, it's close to where that movie was filmed. And I was working with Doctors Without Borders, and I was a physician for the team. We were a team of 4 people. I was the doctor, there was a nurse, there was a logistician, and medical technologist. And we were running this hospital, so from a medical point of view, it was an extraordinary time. It was a really we're seeing sick people all the time and helping make them better. I was doing what I was trained to do. I was trained in primary care, acute primary care, and I was living acute primary care, and I was really helping people who came into hospital and helping some of them live. And there was one case, there was a boy who, I don't remember his name and how old he was, but he probably was about 10, which is the age my daughter is now. And he was really sick. He was really sick, and we didn't have much diagnostically. It was almost certainly an infectious disease. And I treated him, looked after him, and he got better. He got better. 5, 6, 7 days later, he walked out. He was very happy. The family was very happy, and it was a really great moment. And we had lots of those moments while I was working in Somalia. And from a medical point of view, I felt like I was at my peak. I was trained to do this kind of work. I was doing it. I was seeing very gratifying people living, people doing well because of what I could do. And this had this paradoxical effect on me. Instead of elating me, instead of me feeling like I have found my calling, I'm making people better, I just couldn't help but feel that the boy was going out there and he was going to get sick again and maybe he'll die. And I couldn't help but feel like, well, what will happen if I'm not here? What will happen if there is no other doctor that comes after me? Or what if there's a doctor who's not trained to deal with these kind of things? Because the boy will come back and other boys will come, other girls will come, and they will get sick and they will die. So I got very discouraged. I felt like I could definitely see the utility of what I was doing, and there was no question it was the right thing to do, and somebody needed to do it. But I was just haunted by this question of, there must be a better way. There must be a better way of doing this so that the girls and boys are not getting sick to begin with. So I didn't know anything about public health. The medical school I went to was very conservative, and we heard about public health almost as a whisper in the hall. And I knew nothing about it, but I had an acquaintance, really an acquaintance, who also was a physician, and I remember that she had done an MPH. That's really all I knew. And I decided to apply to do an MPH. And I then I applied, did most of the applications from the desert of Somalia. And my partner, who's now my wife, we applied together. She was working in a different part of the world at the time. And we both went to do an MPH together. And I came to public health, and I really felt like I found my place. I found a place where I was learning how to create the social, economic, cultural, political conditions that make people healthy. And that is ultimately what I felt I wanted to be doing with my time, with my life. And that's how I came to public health. I was unexpected. I was doing medicine. I felt like this wasn't enough. It somehow wasn't right. Went to public health. I thought I would do an MPH. Thought I would go back to medicine. I had spent many years learning to be a doctor, being a resident. I had my own practice, and my intention was to go back to medicine. But I did the MPH, and it stuck. And I realized then I could not leave. And I have since had a life in public health, and I have no regrets. It has been deeply satisfying and fulfilling.